So what about this COVID-19 antibody blood test? There's been so much talk about it, and people are calling and asking, should I get the blood test? I had the nasal swab. What does the test? What does it tell me? How important is it? What does it test for? Who needs it? And so that's what I would like to talk to you about today so we can have a better understanding about if you need the blood test or not. So first of all, let's talk about how the body responds to a foreign object or a foreign body, such as COVID-19 virus. When the virus enters the body, our bodies respond to viruses, bacteria, anything that's foreign by producing proteins that we call antibodies. Those antibodies will respond to that foreign substance, in this case COVID-19 virus, by connecting to a part of that virus called the antigen. The antigen connects to the antibody. The body has produced a protein called an antibody, and that antibody will connect to the virus, the part of the virus called the antigen. Once the connection's made to the antibody, then the body begins to produce more and more antibodies in response to the entry of this virus into the body. There are two types of antibodies. There's antibody called IgM. It's in response to the foreign body, in this case COVID-19. It makes the first antibody to an acute reaction is called the IgM antibody. If you check the blood and you see that you have IgM antibodies, you can say that there's an acute reaction. In other words, the patient just was infected with the virus recently, within the last let's say 2 to 4 days. If the antibody is an IgG antibody, that tells us that the body was infected with the virus 2-3 weeks ago. So it's important to know, or it tells us some information about whether this was a recent infection or whether the person was infected with the antibody 2 to 3 weeks ago. So that becomes important when we're looking at these antibody tests. So one of the things that we have to look at with any test, and especially this antibody test, this blood test that we have, is how good is the test? And when we look at a test, we look at the sensitivity versus the specificity, or the sensitivity and the specificity. Sensitivity means that when we do the test, it will tell if the virus is there or not. So when we do a test and it's 98%, then we can say that that's a good test, because when we do the test, it's telling us that there's a 99% chance that the person really does have the antibody. So we don't come up with these false positives and false negatives. We want a 99% sensitivity. The specificity, we want it to be also 99%. The specificity tells us there's no antibody there in the blood. And so when we do the test and it comes up negative for antibody, and it's a 98 to 99%, then that tells us that there's no antibody there. So again, it rules out any false positives or false negatives. So back in March, when everybody was scrambling around to figure out how are we going to contain this virus, and should we do antibody tests, and from a scientific standpoint and logically, it was, yeah, we need to have a test that tests for antibodies against the virus to see if the person has been infected or not. There were probably about 200 laboratories that came up with their own test. And these tests were very expensive, millions of dollars and these tests were sold to hospitals and different healthcare facilities because it gave it gave them an edge. I mean, if you can show that the person has antibodies that have been formed, you can say with some confidence that this person's been infected. Well, as it turns out, these tests, their sensitivity and specificity was down low. I don't know how low it was, but I can tell you that it was not 98, 99%, and it was very low. The FDA at the time, because we needed something, they were letting these laboratories produce these tests and sell the tests to different people. Now we're down to, there's about 6 laboratories that have the test, that have the 98 to 99% specificity and sensitivity. And so one of the things that you want to do is, if you're going to get the blood test, okay, if your doctor recommends you getting that blood test, one question that you want to ask is, what's the sensitivity and specificity of the test? So the FDA had, for those 6 laboratories that are able to do the test, they have something called emergency use authorization. If I were going to get the blood test, my question to my provider or the lab is, does it have a 98 to 99% sensitivity, 98, 99% specificity? That's the important thing with this blood test. So you want to make sure that you're getting a good, solid test. So who should get this test? Well, we know that we want to get a test has the emergency use authorization. But now, if you get the test, what value does that test mean to you? So if you're a public health worker, epidemiology, and you're looking at communities, I can see where they would want to know how many people, in fact, have been exposed and have contracted this. And they would do their studies, epidemiological studies on that. But you, as a patient going into your doctor's office, just hearing about the blood test, who should get that test? Or should you get that test? Is it appropriate for you to get the test, even though it is going to give good information? Nobody really has any hard, fast rules about that. But personally, I think that people that are working in areas where there's a high potential of people that have COVID-19 that are positive, in hospitals, nursing homes, doctor's offices, grocery stores, those places where you got lots of people coming and going. You may have people that are symptomatic. So if you're one of those people that are in those areas, a healthcare provider, a bus driver, working in those areas where you're coming into contact with a lot of different people, and you possibly could have, you could be positive but asymptomatic, maybe you should get that test. But I think that that's a conversation that you need to have with your healthcare provider, because we don't want everybody just getting the test just to see if I'm positive or negative. There's another test out there also that will measure the amount of antibody. It's an immunoassay. Forget the big word, but it's a test that will measure the concentration or the amount of antibody you have. That sounds like it would be a pretty good test. The amount, on a scale of 1 to 10, if you take the test and you have 10, you're at a 10, and that means your body's full of antibodies against COVID-19, versus a 1, and you haven't really, you have antibodies, but they're at a 1. That could be helpful. I could see where that could be helpful, but I'm not an epidemiologist. I'm not an infectious disease doctor, but I want you as a patient and as a person that may be infected by COVID-19 or be around people that have COVID-19 to understand these different tests. So if you like this video and you want more content and more information, like the video, go to our website, or be a subscriber to our channel. Thank you.